the other one is someone who works in the CBD, and Dr. Chant will provide greater detail about her concerns about making sure we don't have an emerging cluster by people working in the CBD or having frequented certain venues. So we please ask everybody to make sure you keep looking at the health website or the New South Wales Government website, which lists the new venues that are coming online. If you've been exposed at any of those venues, depending on whether you're a close contact or not, you need to get tested and stay home for 14 days. And can we say at the outset that it's so important for people who are in isolation for 14 days that you do that for 14 days. You might be negative until day 11 or day 12 and then you're positive, because we know that's how the disease works. So if you've been asked to stay home for 14 days, please do so. And we know how hard it is over Christmas. We know how hard it is over Christmas, but please don't visit anybody that's in isolation. And if you are in isolation, please don't have contact with anybody outside of your household, because that could again pose a risk to the cluster, to a new cluster emerging, which we certainly don't want. But can I firstly say how proud I am? I nearly fell off my chair literally when Dr. Chant and I and others realised that 60,000 people came forward to testing to 8 p.m. last night. That 60,000 people in one 24-hour period is beyond outstanding. Can we thank everybody for responding? I especially want to thank not just the people taking the swabs, but also the pathologists who are working 24/7. I've had people tell me they're getting their test results at 3 a.m. and 4 a.m. It's a 24/7 job, but that's what's allowing us to stay on top of the virus. So the best thing we can do is to support their efforts by coming forward and getting tested, even with the mildest of symptoms. And can I stress to people, if you happen to develop a symptom on Christmas Day or Boxing Day, please go and get tested. We will have 300 clinics across the state, private, government, pathology testing units working throughout the night, private and public. Our health people and the supporting pathologists have just been amazing. So even if you get a symptom on Christmas Day or Boxing Day, please go and get tested. Do not wait till the 27th, because if people wait, you could be unintentionally infecting people and ruining Christmas for those closest to you. So our message strongly is please get tested no matter what day it is. And given the response and the feedback, people are getting their results in a couple of hours, within half a day. So please make sure even getting tested and staying isolated for that period of time means that all of us can stay safe over the next few days. Now, the strongest advice that our health experts will give you about the next few days is please limit your mobility. Please do not move around unless you have to. We appreciate that there are restrictions in place which allow people to have people into their households, but please make sure all of us reduce our mobility, apart from those close family gatherings, which we've allowed over the Christmas break. We don't want people moving around unless you absolutely have to. Every health expert will tell you the greatest way the disease spreads is by people moving around too much and having contact with one another. So it's really important to reduce your mobility, limit your activity to those close family gatherings. Don't do anything you don't need to do. And please, of course, if you are in contact with people, make sure you're socially distancing. If you're in an indoor setting, please make sure you're wearing a mask and make sure you're using hand sanitizer at all times. So we need everybody to be extra COVID safe over the next few days. Don't let the celebrations or the Christmas activities reduce the necessary nature in which we have to be on guard. So again, can I stress, don't do any activity unless it's necessary, and we appreciate there'll be small family gatherings, small gatherings with loved ones. But even then, all of us have to be extra COVID safe. You don't want to give the disease to people you care about the most, and we have to be on guard. But the testing results are beyond amazing and encouraging. We need to keep it up. So our strongest message is please get tested no matter what time of the day, no matter what day you feel the onset of a symptom, or if you've been determined that you're a close contact or a casual contact. Make sure you keep looking up the website, looking at all those venues that have been identified as someone with the virus having been there. And if health says you're a close contact, that means you have to take a test and you have to stay home for 14 days. If you're a casual contact, follow the health advice. And also as a precaution, make sure you continue to look at the information available on the times that those venues were deemed to have someone infectious there and whether you were there just prior or just after those events. It's really important for everybody to do that. At the moment, the results, given the number of tests and given the number of cases, they're positive, but of course we need to keep seeing those case numbers go down. We still know that the virus is circulating in parts of the community, and I want to thank everybody for your patience, but also the way in which the community has responded to the messages we've been giving, and that has to continue. Dr. Chant, especially in our briefing today, has highlighted to me, and she'll emphasise this as well, we are concerned about people who may have been infectious, who went to work in the CBD and then have passed that on to other people in the CBD, and those people have then passed it on back in their communities. They're all eventually linked to the Avalon cluster, but it does mean there's potential chains of transmission that we're not on top of, and that is a concern, and Dr. Chant will provide further detail around that. So I just want to say thank you to everybody for your vigilance. My strongest message is we are far from out of the woods. We're not out of the woods by any stretch, and in fact, we have to be extra vigilant over the next few days. We have to make sure we get tested with the onset of symptoms. We have to make sure that if we're isolated, we stay in isolation. We need to make sure we don't visit people in isolation. And we also need to make sure that as much as possible we reduce our mobility. We don't move around. We don't do things unless we absolutely have to make sure that all of us get through this period as safely as possible. Dr. Chant?
So New South Wales recorded 9 new locally acquired cases of COVID in the 24 hours to 8 p.m, and of these 7 are linked to the Avalon cluster, which now numbers 104. So overall in the investigation, we have 6 cases that currently remain under investigation. 2 of those are the patient transport workers. One of those sequences is linked genetically to the Avalon cluster, and we're waiting sequencing on the second patient transport officer. 2 are geographically linked in the sense that they attended a number of the casual venues. Both reside in that area of the northern beaches. 2 of the new cases overnight. One is a gentleman in his 20s who resides in the northern beaches. Those test results on that individual are still being worked through, but given the critical nature of this response, we're taking a very precautionary action in regard to that test. It may be that he's got an older infection, but we are forensically looking at that and taking the public health action as if he is positive and infectious now, and looking at whether he had any potential to transmit it to anyone. I can confirm that his household is negative, but we are looking at other close contacts in from the workplace and his friendship groups. There was also a male in his 40s who worked in the CBD. There were 60,184 tests were reported to 8 p.m. last night, and there continues to be increases across most local health districts in New South Wales, with Northern Sydney, Southeastern Sydney and Sydney showing the most significant rises. It is important that we're not complacent today. We really do need to come and get tested, and anecdotally we have had some feedback that our clinic lines aren't as long as they were before. Please, if you have the mildest of symptoms and you are anywhere in this state, please get tested. In terms of venues that we are concerned about, there is one of the new cases reported today which is under investigation, attended the sports bar of the Paragon Hotel in Loftus Street, Sydney, near Circular Quay. They are believed to have acquired the virus while visiting the hotel between 12:45 p.m. and 3:30 p.m. on Wednesday the 16th of December. This is the second case of transmission at this venue, which now has 3 cases associated with it. So just to reiterate, patrons who were at the sports bar during this time for more than 1 hour are considered close contacts. They need to get tested immediately and self-isolate for 14 days regardless of their results. Anyone who was there for less than 1 hour needs to get tested immediately and to self-isolate pending a negative result. And people who attended other areas of the Paragon Hotel during this time should monitor for symptoms and isolate and get tested immediately if symptoms appear. Anyone who's been in this vicinity should have a very low threshold for testing and come forward with the most minimal of symptoms. In terms of the CBD, another of today's new cases under investigation is an office worker in the vicinity of Hunter and Blythe Street in Sydney CBD. This is the third case in an office worker in that part of the CBD. Anyone who has been in the northeastern part of the city, including the Australia Square, MLC Centre and Chifley Square, should be alert for symptoms and isolate immediately and get tested should even the mildest symptoms develop. So I'm just asking anyone who has been in that area, please have a very, very minimal threshold, low threshold for testing, and please come forward immediately. Bondi, people who attended the Bondi icebergs on Sunday the 20th December between 8 a.m. to 9:30 a.m. and or Monday the 21st of December between 7 a.m. and 8 a.m. are asked to get tested and isolate immediately. New South Wales Health will call you today to provide further information and advice depending on your exposures in that setting. In terms of some other key points that I'd like to make, in terms of a safe Christmas, as the Premier has indicated, if we can really limit our mobility at this time, if we can keep our gatherings small, and if we can also choose and preference outdoor settings. So if you're hosting a Christmas dinner for your small group of family, please see if you've got a veranda or an outdoor area where people can congregate. We know that those areas are much safer than indoor environments. But can I please stress this point, that if we have asked you to isolate, you need to be in isolation. I apologise to everyone who has been put in that predicament, but it is incredibly risky to leave isolation any time prior to those 14 days post your last exposure. I'd also like to highlight that exposure venues change. As you can understand, people often frequent venues, so if there's a transmission event, the time you may well have gone back to a venue at a time and place where a new positive case is. So again, I apologise, but that will mean that there's an extension to your isolation period. So please check the website and be very clear about your exposures at this time. Also, please do not have visitors into your home if you're isolation. Isolation means isolation. It is critical that we do not see any inadvertent transmission from people in isolation. I know this is a challenging time of year, and if other loved ones could please reach out to people in isolation and use technology, phones and other means to really support them, because they are doing the hard yards in protecting you, their loved ones and the broader community. I'd also like to say that we have about 300 testing locations across the state, and many of those will be operational over the Christmas New Year period. So do not delay getting a test. Also, elderly and vulnerable members of the community will be fast-tracked. So if you've had any concerns that you've seen those queues and you're concerned that you may not have been able to stand up for a period of time, please draw that to the attention of the nurses or the staff that are staffing those clinics. We have been prioritising the elderly and vulnerable members of the community, and they'll be fast-tracked in testing queues. And please, if you're younger and more able, please understand when people are being pulled out of the queues for those reasons. We really appreciate the fact that the elderly and people with other disabilities are presenting for testing, and we do need to make it as easy as possible. In terms of, I would also like to draw your attention to, I mentioned yesterday at the press conference, there was a Qantas flight from Darwin to Sydney. All the people who were on the flight from Darwin to Sydney are now considered close contacts and will be immediately tested and asked to self-isolate for 14 days. We are investigating another possible case with our colleagues in another jurisdiction that may be linked. The information is very preliminary, but as a very precautionary step, we're calling everyone on that plane close contacts. That advice may be updated later today, but we feel it's most prudent to take a precautionary approach and then potentially wind that back when more information is to hand. Again, thank you to all of the people in self-isolation across New South Wales. I really genuinely appreciate your efforts.
Dr. Chant, the Paragon Hotel, is that related to the Avalon cluster, or is one of the cases reported today one of the...
No, the Paragon Hotel case is related to the Avalon cluster.
You really stressed this 14-day quarantine period. How many instances are there of people getting negative tests and not making the quarantine?
I think the point is that this is a really confusing issue for people. And I think that I really appreciate that the community, why I'm reiterating the message is we just need to make it very clear and easy. The concept of an incubation period is very familiar to health officials and health professionals, but it's not something that the everyday community member has really had to grapple with. But we're trying to explain it simply to people to make sure they really clearly understand it. And the majority of people are incredibly cooperative, but I'm just highlighting some issues in my communication. It's not because people have raised issues that people have wantonly gone out and avoided isolation, but it's just to explain to the community the rationale. That if I'm infected today and I cough on James or one of the media people, you are then at risk for that 14 days. We ask you to get a test, and the reason for that is that often, as you've seen, we find out about an exposure venue about 2 or 3 or sometimes 4 days after the event. And because the average time for infection can be around 5 to 7 days, we can actually pick up people very early by having this strategy of testing people immediately, then isolating them. It also gives us additional information about the risk of the setting. So if we actually see some of these cases turning positive, we know there's a transmission venue. And I've been updating you this week on those sites where we have a higher concern level because there has been transmission at those venues. So we really appreciate it, but it is a bit confusing, and I'm just reiterating it for that purpose alone.
The CBD worker in today's numbers, does New South Wales Health have an idea of where that CBD officer contracted the virus, or is that still under investigation?
It's under investigation at the moment. So I will update you with any new information, but it is as I've said it this morning.
And the same CBD worker, is there a...
So what we've concerned, I've released today, and this will be in the press release, and I appreciate the vicinity. What we're concerned about is that people from the Northern Beaches travel out of the Northern Beaches, and they may have unknowingly travelled, as many did, prior to it was recognised this outbreak occurred, this cluster. They have done nothing wrong. They didn't know they were travelling at that time. But what we're concerned about is that there could have been unrecognised chains of transmission occurring, and that's why we are, with the latest information, highlighting this risk to the community so the community can take action. And the action we're requiring is, if you have been in this area of the CBD, get tested. And we're conveying this additional risk that we see particularly in this CBD area.
On this slide, you mentioned that you're investigating a potential other case with another jurisdiction. Is that the Northern Territory, or is there a suggestion
that person is a South Australian case, and I can confirm that person tested negative in New South Wales, and we're just trying to work out the nature of that test result, whether it's a false positive or whether it's an old infection. It's very scant information, and I apologise we sometimes don't have the full picture, but it's important that we take that sort of cautionary action initially while we're getting further information to hand.
Are you any further that everyone on that flight is now being treated as
That's correct.
Were there passengers on the flight, or was it just crew?
There was passengers on that flight, and last night we contacted a number of them that were sitting close to the person that returned. I remember I said yesterday that a flight crew who had been overseas returned to Sydney on that flight from Northern Territory flight to Sydney. We had identified people in a small group of people that potentially were exposed to that individual on that plane. With this new information that came in literally approximating midnight last night, we've now taken a precautionary action to notify people on the plane as that they're close contacts whilst we work through this information. It may turn out to be different in terms of our advice, but today we're asking everyone on that plane to isolate and get a test.
You tried to lock in the virus to the Northern Beaches, but each day we get here, there are new transmissions spurring from in the transmission outside the northern beaches. Is it predictable, or is this a major setback in your battle here?
I think it's predictable, but we need the community to respond. We need the community to do those public health measures to make sure that we don't we mop up any unrecognised transmission that's occurring, and that's why I'm making a particular point of the CBD. I think it's an area where we've seen these 3 infectious people, and we are just highlighting this additional risk level to the community so they can respond. And can I just say, 61,000 people who have presented for testing in a 24-hour period. I just want to thank the New South Wales community for responding so well. The testing numbers, again, I'm not going to tell you what they are yet. We'll release those data, but I'm again stunned at the levels that of testing that we've had overnight.
Would you have thought you'd be standing here and saying there's a lot more cases of COVID than just 9?
I think the Premier has summarised it very accurately. We are not out of the woods yet. We need to work together. We need to track down any unrecognised transmission, and people have a role to play. People shouldn't be out and about with symptoms. Do not risk transmitting COVID. Christmas is a time where we often spend time with multiple generations. Many of our elderly family and friends have comorbidities or underlying illnesses that put them at greatest risk of COVID. Now is not the time to take any risks, and we ask everyone to be acting responsibly. However, I have a lot of trust in the New South Wales community, given the response to date, and I think if we can work together over this difficult time, and if people can delay group gatherings, split group gatherings, or delay them into the further new year, as the Premier has said, we're really asking people to limit your mobility, limit your gatherings to the key people that you need to see because that's important to you, and if you can delay those, please do. And note that we are not permitting any aged care visitors into the Northern Beaches or the sub-Northern Beaches local government area. And we also, unless it's in end-of-life care situations or very extenuating circumstances, and again, we really want to caution people about never, whilst in some parts of the state you can visit aged care relatives, you will be wearing masks, and again, do not take any risks. If you have the minimal of symptoms, delay it, contact the aged care, your loved one through phone, mobile, do other sort of mechanisms of reaching out to them. I know this is incredibly difficult, but we do not want to impact the most vulnerable in our community.
On Christmas, it's infectious diseases experts have described it as almost an accelerant event. Are you prepared to accept the risk, and especially the risk in the Northern Beaches, of allowing people into the homes?
In terms of the Northern Beaches area, it's only allowing people from within the Northern Beaches, not people in isolation. We're asking people to take precautions, and there's been incredibly high testing rates. This is basically obviously risks, but we have to balance people's mental health and social wellbeing. We've really said if you can have those events outside, please do so. We are urging people to limit their gatherings, and again, the response to the community, the mobility data is actually showing it has dropped significantly, and people have been following our advisories and our directions. So I just again thank the community for that. We are asking the community to really reassess any non-essential travel on Christmas Day. Keep your group gatherings to as small as possible, and please choose outdoor venues if you can, because that reduces the risk. But really select the people you need to be there with and limit it, and space it out into the new year, later in January.
Your comment on aged care.
Please released by, perhaps it's the Premier probably might ask this quickly, is it an honor system up on that Northern Peninsula, or will there be extra police going on?
Can I stress that there will be extra police out and about, especially in relation to those borders or the boundaries we've set up around the Narrabeen Bridge, the Roseville Bridge, Manavar Road. There will be an extra police presence, and police obviously will make sure that everybody is aware of their rights and obligations during this time. But we're also very confident the way the public's responded to what we've asked them to do has been overwhelming, and absolutely overwhelming. And it's exceeded my expectations, but we need this to continue. We're not out of the woods. We know from the number of cases we've had outside of the Northern Beaches, which are linked directly to the cluster, but they're still concerning because we don't want them to start a new train of transmission or a new cluster elsewhere, and that's what we're really fighting against. So yes, police will have a stronger presence. At our normal meetings, obviously the police have a critical role in advising government on these matters. There'll be extra police presence. There'll be extra support for the community. But we, in the main, are confident people are doing the right thing. There are very, very few people that aren't. But all of us have to be vigilant, and I can't stress enough, all of us have to reduce our mobility. Don't participate in any activity unless you absolutely have to. Make sure your gatherings are as small as possible. Make sure you're taking care of those most vulnerable. Many of us have parents or grandparents or people with comorbidities. We just have to be extra careful around family members and friends who are in that category. And a lot of people will probably take a more conservative approach and choose not to participate in activities they'd normally do around this time of year. And having said that, we've balanced that against what we understand families will do responsibly when they are getting together.
Premier, how concerned are you, Premier?
Well, look, we're hopeful. Look, we're hopeful that we can have those events continue in a COVID-safe way, and we're, key members of my government are having conversations with those organisers now, and we're confident that we can host. I mean, look at our record. We've been able to host many events in a COVID-safe way, and that's our intention. But it also depends a lot on how we go the next little while, and I'm confident people will continue to do the right thing. But we do want to see those case numbers go down. We want to see the number of venues affected reduced. But as Dr. Chant said, a lot of the things happened previously when people weren't aware of the cluster, weren't aware of the actions they needed to take. And so we're still mopping up from that. But moving forward, we ask everybody to be aware of this and to be sensitive. And I also recall, even when you look at people who've come from overseas in quarantine, often we'll swab them on day 2 and they're negative. We swab them again on day 10 and they're positive. So that's why the 14 days isolation is so important, because the disease can emerge in you in that period. And that's why it's important to respect that period of time, not cut days off and not go and see people in that period. Even if they've tested negative on day 2, they may very well be tested positive on day 10 or 11, and that's why we need everybody to really appreciate that.
How concerned are you that a patient transfer services workers that return sick travellers from the international airport was also tasked with transporting a resident in an aged care home in Castle Hill? Why was this allowed to occur? Has it ever happened before? And what will you do to make sure it never happens again?
Well, of course it's always concerning when examples like that are brought up. I might ask Dr. Chant to provide an update. She's across the detail more than I am.
So yesterday we announced a genome sequence which identified that the patient transport worker didn't actually acquire it from the infectious patients that they were transporting, that the most plausible hypothesis at this time is that they're linked by an unknown source to the Avalon cluster. Investigations are continuing, and obviously that's one of those unlinked cases that we are really keen to get to the bottom of, because it represents a chain of transmission we can't explain. In terms of the usual precautions, clearly we have quite good cleaning, PPE requirements around both ambulances and patient transport vehicles. And what it actually highlights is that we need to be vigilant that anyone at any time can have COVID, and that's why we take the precautions of staff wearing masks when we're concerned about community transmission, because we need to protect the transmission patients from that. So those processes of lifting our alert system to a higher alert and requiring staff to wear masks in our healthcare facilities is part of that prevention, that we inadvertently don't have community transmission affecting our healthcare workers and they pass it on. In terms of that issue, we are certainly going to, for the added precaution, make sure that there is no transfer and overlap of crew that are potential patient transport staff that are actually transporting people from the international airport, and just separate those. That process was in place, and we're now reinstating that. But I should assure the community that there will be times where infectious patients are transported in our ambulances, and we thoroughly clean them and have a process for making sure that the next patient is safe.
When did you stop that process?
Immediately when this issue came up, steps were taken to put that added assurance in, as well as existing requirements for cleaning and PPE to ensure that overlap. And I think it's an important measure that needed to be in place.
Sorry, you said there were measures to ensure no overlap, and now
it had been.
There before, or
It was there before, but for some reason there was a reversion to not that process. I don't know that exactly, and we then have reinstituted the separation. But can I be clear about this? That we have the cleaning, in this case, the greatest risk to the patients was actually in the infectious staff member who actually got it from community transmission. And so the steps we took once we recognised this transmission chains were occurring was to lift the requirement for mask wearing across clinical settings, and that's why we also instituted that in aged care and changed the visitor policy in regards to that. The purpose of that is to protect the community or the patients from having a healthcare worker who's actually acquired it in the community infect them in clinical settings, which I would include providing care to someone on a patient transport.
Premier, with respect, it's not relevant whether or not this PPS worker caught the virus in the community or in a van transporting sick patients. Because I'd like to know if you have put in place any extra measures or sought any explanation from your public servants about how this happened.
So I can address that for the Premier, that immediately this come to light, intensive investigation was undertaken. A lot of new steps were put in place, including making sure there was no overlap of crew that transported any infectious patients from the airport or from any of the police quarantine facilities. So there is total separation of crew, and can I be clear that that is an appropriate response? There was a reversion. That policy was in place. For a period of time it reverted. We are still investigating the nature of why that reverted. We apologise for that, but just to reassure the community that we do have those cleaning PPE requirements to ensure that patients can be transported safely, because we also have to assume in the community that our patient transport vehicles may be conveying someone who inadvertently has COVID that is not known at that point in time when we have community transmission.
Will you seek an explanation as to why that policy reverted to allow PPS workers working in transferring sick passengers also transfer aged care residents? Will you seek an explanation?
Why would you assume I haven't already? In fact, as soon as it was brought to our attention, I was already advised that the operational readjustment had been made. So let me assure the community that in New South Wales, when anything is brought to our attention that concerns us, it is acted upon immediately. Those operational issues were actually dealt with before me even having to ask the question, because experts who noticed that were able to revert back to the policy. So I want to give people an assurance and the confidence that our system is strong. Any time that there's an operational matter where things could have been done better, policies are adjusted or in fact reverted back to what the original was. But we also have to assume, with all due respect, that when you have thousands and thousands of people working to keep all of us safe, sometimes mistakes will occur, sometimes unintentional decisions will be made lower down operationally, which shouldn't be made for a temporary period, but the systems in place are there to make sure that I believe we have one of the strongest systems in the planet. But mistakes will continue to be made, and I can't pretend that's not going to happen. And that's
return to travellers. We've seen the people who are able to quarantine at home, police are manning their homes. Is that at the cost of the taxpayer or of the resident?
Well, for return travellers, if you mean those that are in hotel quarantine, those rules are...
Quarantining at their own home.
I'm not sure of those arrangements. I'll have to get back to you, but certainly police's main role is to make sure that people in hotel quarantine, people being transported in the quarantine system, are done so appropriately. Police also have more general compliance responsibilities, but I'll have to get back to you on that.
Do you know how many people are quarantining at home at the moment?
I don't. I'll have to get back to you.
Dr. Chant, sorry, you mentioned it would be close to 300 over Christmas, Boxing Day, etc. Are you expecting any reduction in testing capacity, in staff numbers And if so, how much?
Can I also just, I think probably I missed to acknowledge one group, our private pathology laboratories. So we have a mix of a system where the public health laboratories in our public hospital system stands up clinics, but we also have GP access to testing through GPs or private laboratories. There may be some decrease in GPs that are open over the Christmas period, and there may be some decrease in private pathology runs over that period. However, I just wanted to get a message to the community that there will be public sector clinics open, and please seek them out and don't delay, and please take a cautious approach. If you wake up on Christmas morning or even tonight in Christmas Eve function, you've got the most minor symptoms, don't risk it. Stay at home. I think everyone will be incredibly understanding of why you are not attending this event and actually applaud you. You don't want any regrets at this time.
Just on the staffing at the testing clinics themselves, will there be a reduction?
For the public sector clinics, I can't speak for GPs and I can't speak for private pathology providers, but in terms of the public system, we're certainly conscious of making sure that there is sufficient staffing to meet the demand over the Christmas period. And that's why we've specifically mentioned today about the need to get tested regardless of the time. I would actually like to see a real run on testing today for anyone who's been in any of those areas that I've highlighted, should they have the most minimal of symptoms. So look, I'm really pleased to say that our testing turnarounds are still holding up there. And can I say that thank you very much to the hard work of the labs who are just churning out multiple runs. I can't imagine that the scientists in those labs are not exhausted. So thank you for your contribution to the efforts, and we will continue to work as hard as possible over this period to sustain those rates of testing.
The AMA has come out saying the fireworks attendance should probably not go ahead now.
As part of the process, we'll consider all our settings. Our concern levels, I think I've been very transparent in the areas I'm particularly concerned about, and that relates to any transmission in the CBD area, just to be very cautious about that. We will reassess this information on the morning of the 26th, and as the Premier has indicated, there will be a crisis cabinet, and we'll think about all of the settings we need to have at that time.
We know it's a beloved thing for Sydney, but maybe it is to stay on home.
Look, the fireworks display themselves will definitely be happening at midnight, and we've already said that we encourage everybody to watch that from home. We have at this stage provided some access for frontline workers and others, but again, everything is reassessed based on the most recent cluster of cases. So we will provide information to the community in a timely way, but we will also wait till the end of the couple of days now over Christmas before we make an assessment based on the health advice. And we have to appreciate it's an outdoor setting and there are certain things that can be done safely, but other things that the health experts might tell us they're concerned about. But the actual display itself, the 7 minutes of fireworks at midnight, will be happening no matter what. But I'll certainly be watching it from home, and we encourage everybody else to do that as well. And also, we've already said that the restrictions have gone to 4 square metres in hospitality venues, so we ask businesses to start making assumptions around that. If you've taken bookings based on the 2 square metres, you will re-evaluate that and make sure you've based that on the 4 square metres, and we'll say that from now. But obviously, we won't make a final call on any of those matters until a few days has passed.
Given the circumstances, the icebergs, do you know if they were swimmers? And if so, is there concern that they spread that virus into the water that remains stagnant yet?
No, we're not concerned about that. The way in which we're concerned about the COVID transmission is those cases, the normal way is those cases are interviewed. We look at where they've spent time, whether they've spent time in the change rooms and other settings, and that's why I've indicated just stop and stay, what's what we call a stop and stay advice, which is please isolate, get a test, and we will be back with you to talk you through the exposures and assess what your level of risk is and give you that tailored public health advice.
Premier, given the circumstances of last weekend in 2020 in total, what assurances can you give kids
that Santa Claus and his 9 reindeer, being Rudolph, Dasher, Prancer, Dancer, Vixen, Cupid, Comet, Donner and Blitzen, will be allowed to pass quarantine procedures currently in place, and particularly so in areas currently under lockdown, so he may deliver wonderful gifts and toys to those who've been nice, not naughty.
Yeah, well, I can confirm that our authorities have been in direct contact with Santa Claus and his people, and we've told them he has free reign throughout New South Wales, so nobody needs to worry. But we are providing a recommendation that children leave some hand sanitizer for him. He has plenty of masks, but he is running out of hand sanitizer. So if children could leave that for him in addition to biscuits or anything else, that would be deeply appreciated. Thank you. Thanks, everyone.